Hello again. My name is Annie from Stay Home, Stay Connected. I'm excited to introduce our group facilitators for today's session. We have Jessica Suga and Jill Brown from the Obstetrics Initiative. Jill and Jessica are both registered nurses who serve as liaisons between the Obstetrics Initiative Coordinating Center and their 74 participating hospitals across Michigan. So today they'll be talking to you about their mission with Obstetrics Initiative, as well as some shared decision-making and partnership goals during pregnancy. You guys take it from there.
Thank you, Annie. Good morning, everyone. Thank you so much for joining us. As Annie said, my name is Jill Brown, and with me is my partner, Jessica Soba. Together, we make up the clinical site engagement team for the Obstetrics Initiative. Jessica and I are both nurses with strong backgrounds in women's health. Jessica is a former labor and delivery nurse, and I was a mother-baby nurse for many years. In our current work, we support hospital teams at over 70 hospitals around the state of Michigan, but we both miss working directly with families at such an exciting time in their lives. So it's really our pleasure to be speaking with you all today. So this slide here shows the homepage to our website, and I just want to give you a little bit of background about the Obstetrics Initiative. You probably haven't heard about us, but the Obstetrics Initiative is a quality improvement initiative that focuses on women's health. In full disclosure, I want to say that we are funded by Blue Cross Blue Shield of Michigan in order to support their mission of improving the care of women across Michigan. OBI, as we like to call ourselves for short, has been in existence for about 3 years. And our first goal is to reduce the primary cesarean delivery rate in Michigan by safely supporting vaginal delivery. So that's what we're really focused on right now, and sort of where the context behind what we're sharing today. We do this mainly by encouraging hospital teams to optimize care of the laboring person. One of the tools we advocate for hospitals to use to support this work will be discussed by Jessica here in a little bit in this presentation. As I said before, our first mission as a collaborative is to reduce the incidence of first birth cesarean deliveries. But we want to recognize that sometimes cesarean deliveries are necessary and life-saving. We should never be viewed as a failure. So we want to make sure we get that message in there too, that our goal here is to help all pregnant persons in Michigan have a positive birth experience no matter what the outcome is. The Obstetrics Initiative website is public. It contains a lot of great resources that's open to everyone. So feel free to go there, check it out, poke around, and use whatever looks interesting to you. And Jessica and our contact information is in there as well. So always feel free to reach out to us if you have any questions. So our focus for our talk today is going to be really diving into what is shared decision-making, how the shared decision-making process is supported by birth partnership documents, and we'll tell you a little bit more about those here soon. And then Jessica's gonna give you some examples of how birth partnership documents and shared decision-making strategies are used during prenatal care and how that carries over into the hospital setting to help support the birth that you want and envision for yourself. In an effort to make patient-centered care a reality, shared decision-making has gained traction in the medical community. And for good reason. Evidence shows that when patients are involved in decisions regarding their care, outcomes and patient satisfaction are improved. Shared decision-making is a broad term, but this definition, I think, really does a nice job of stating what we strive for in supporting decision-making in maternity care. So really in this context, shared decision-making is an actively engaged process between clinician and patient that takes place during a healthcare encounter where a patient is supported to consider options and choices using current best scientific evidence, and where the patient's preferences and values are central to achieving informed preferences for pregnancy and childbirth. The process of shared decision-making and the tools used to support shared decision-making in maternity care are varied, but should at its core be comprised of and supported by these 3 steps. So the provider and patient should agree that a decision is required. So you may reach a decision point in one of your prenatal care visits, and the provider and patient have an understanding of the evidence, where a discussion will take place regarding the risks and benefits for each available option. The decision is made with consideration of provider's guidance and the patient's values and preferences. So a tool used to support shared decision-making in maternity care is, we call it a labor partnership document, or you may hear the term birth partnership document used. Birth partnership documents are a new twist on the birth plans of the past, and Jessica will go into greater depth here shortly about how they are different. At a high level, the very process of building a birth partnership serves to provide a platform for self-efficacy, empowerment, respecting an individual's unique knowledge about their own body and well-being. They also serve as an educational tool and conversation starter, and provide space for thinking through the birth process and associated options. They also reduce assumptions made either by the patient or the provider. So now I'm going to hand things over to Jessica, and she's going to go through some specific, some real world examples about how birth partnerships can improve your birth experience.
Thank you, Jill. As Jill said, I'm going to dig a little deeper into shared decision making by showing you detailed aspects of the partnership documents and applying them to scenarios that can come up in labor and birth. There will be some points when I will ask questions, and I'll pause to let you take note of your responses for your own reference. So this is a section from a birth partnership document that Jill had pulled up on a previous slide. And discussing personal, religious, and cultural preferences with your physician or midwife is probably one of the most crucial aspects of shared decision-making and the birth partnership process. Whether you're doing an official partnership document or not, I would highly recommend that you discuss this with your provider because your history has shaped your worldview, and it will inevitably impact your preferences. Partnership document should be viewed as a communication tool. It's meant to guide you and your support team in conversations with your providers and your nurses about your experiences and preferences. Now we'll go through some examples of how this applies in the real setting. So at the top of the slide here, you see a section of the birth partnership that addresses when to come to the hospital. And that answer to that question is going to be very different for every birth. There's no one right way to make that decision, but I'm going to go over some steps that you can take to work through the shared decision-making process and come to a conclusion that works for you. You'll want to start by doing a self-assessment or a self-knowledge check about what you know about being admitted to the hospital. What do you know about the early signs of labor and early labor and active labor, or circumstances that may occur that would warrant admission prior to labor? Find out what your support person or your support team members know about the signs of labor and the admission process, and have a discussion with your prenatal provider to fill in any gaps or to reaffirm the knowledge that you have about early labor and active labor. During this time of COVID-19, policies in our everyday lives are constantly changing, and that's true too for the policies at the hospital. You'll want to make sure to ask your provider what those policies are. There's some policies that may be in place about testing and about visitor restrictions. Those may impact your decisions on when to be admitted to the hospital. Consider, how do those policies impact your feelings about timing of admission, and how will they impact your support team? The next thing you want to do is list your options. Use this as an opportunity to brainstorm with your team. Focus on quantity over quality. Come up with as many ideas as you can with your team. Even if you're not really sure about an idea, put it on your list. You never know, it might spark an idea from another person on your team. It's common to worry about being at home during early labor. because of the uncertainty of how quickly you might transition into active labor. You may have fear about not making it to the hospital in time. And there might be visitor restrictions that impact you being without your support team during the early part of your labor. So are there places that you can walk around the hospital but still be in close proximity? Even if you're not sure about walking a lot in labor, put that idea on your list. It might inspire someone on your support team to remember a quiet area and park near the hospital where you would feel comfortable bringing your birth ball. We're coming into the time of year now where it's not uncommon to see women that are nearing labor or in early labor walking through the botanical gardens or the Nichols Arboretum, which is what you see pictured here. Once you have your list of options, you can narrow them down or reorganize them, ranking them in order of your preferences. You can use that later as a reference in your labor. As you're going through this activity, use your knowledge of your personal history. Now I'd like to take a second for you to think about a time when you faced a physical or emotional challenge. For many of us, that time is now, in the midst of a pandemic. How have you handled your personal challenges? What things have helped you cope? Are there things that made it more difficult to cope? Someone who's frequently watching and listening to the news needs to have as much information as possible. Their preferences are going to be very different from someone who needs to shut out the outside world in order to cope with the challenges in their personal world. And neither of those approaches are wrong. They're just different. So far, I've talked mostly about the role of your personal history and preferences in the decision-making process. And if you're familiar with our birth plan, you might be thinking, well, that kind of sounds like a birth plan to me. But in the next couple of steps, I hope it will be more obvious how this process is different. To fully appreciate the risks and benefits of health-related choices, it's usually a good idea to consult a healthcare professional. Well, let's say that you arrive at the hospital and the provider tells you that you're in early labor, but you're making gradual cervical change and you appear very uncomfortable. They offer you the option to be admitted with intermittent monitoring, which is what we see here on this slide. Or you can delay admission until active labor as you had written in your birth partnership. That discussion and subsequent decisions might be very different for you if they instead tell you that they noticed slight lowering of the baby's heart rate when you are on the monitor and triage. And they recommend that you stay for continuous monitoring. In that case, it's very helpful to know what are the risks of the lowering heart rate and what is the benefit of the continuous monitoring. I'm not suggesting that you delay admission when your provider is advising that you be admitted, but rather that having an understanding of why they are concerned about the lower heart rate and what they are looking for in the continuous monitoring might help you be able to make a more informed decision as you go through your labor. Like maybe after a couple of hours of good fetal heart rate monitoring, you could ask if you can be reevaluated if the need for continuous monitoring is still present, or if you could switch to frequent intermittent monitoring. These types of questions can have further complexities that can make sorting out the risks and benefits very difficult, which is why the next step, decision support, is also important. We call this decision support because while your healthcare providers have a wealth of knowledge about health, labor, and birth, and they are equipped to advise you on evidence-based interventions and information, you have the most knowledge about your body and your preferences. It's only through collaboration of these two sources that shared decision-making happens. After going through these steps, you will want to summarize the knowledge you've gained, the options and preferences that you've identified, the risks and benefits, and the support information from your healthcare professional. Keep in mind that there can be changing circumstances that may modify your decisions developed during prenatal care. Some of the potential changes that may happen would be preferences for comfort measures and pain management. Labor may be more intense than you expected. In some cases, it hits fast and hard, and that can be very alarming. So give yourself grace. It's okay if you don't respond to the contractions in the way that you expected you would. Your distance from the hospital. Well, the likelihood of a snowstorm, hopefully, is not something that we have to worry about right now. We are moving into road construction season, so that may impact your planned route and your feelings about timing of admission. or the need for monitoring, as I described earlier. You may learn that there is a need for continued fetal monitoring, which affects your timing of admission. Think about how would you manage that in relationship to your other preferences and the special considerations for COVID-19. Will you be tested on admission? What are the guidelines for visitors? How do those things impact the timing of your admission and your feelings about that? So even if your experience is altered from what was in your partnership or discussed in prenatal care, this process provides a clear understanding of your values and preferences, allowing providers to help make recommendations and decisions as a team. Everything that we've discussed extends beyond the admission decision and into decisions about labor support options. Thinking about the principles that I've laid out, I'd like to try a quick activity to demonstrate how there is no one right way to do this. Let's say that you go into active labor while you're at the grocery store, because I think that's about the only place most of us might be going these days. You go to triage and you get admitted at 6 centimeters dilated. Your partner is on their way to the hospital with a copy of your birth partnership. But in the heat of the moment, you can't remember a thing that you put on that paper. Your nurse offers you some options to try. You can use the list that's here under what options can you try, or come up with some of your own ideas. Possibly what are the first things that come to mind? You can write it down on a piece of paper, take note of it. I'll give you a couple seconds. There will be a lot of variations in those responses, but this is the time to be creative. If you are someone who has enjoyed comedy or has used that as a coping strategy in the past, maybe there's a way that you can use that here too. If you attended or have viewed the last Stay at Home, Stay Connected session, you might recall that Dr. Shaw talked about cognitive behavioral therapy. Dr. Shaw described the main goal is to gather evidence by examining thoughts, beliefs, and basic assumptions to make informed choices. She presented the example of alternatives to breastfeeding for bonding, and similar principles can apply here too. There's lots of evidence that shows that water therapy can work very well to enhance comfort in labor. But if you are someone who has had a negative experience with water, or you have a fear of water, then being in a large tub of water during a vulnerable time may not sound like a good option for you. So maybe you opt for a shower or a partially filled tub with the handheld shower head. Working through a labor support guide or partnership document is about letting your team and your provider know how you feel about the evidence and the various options. Here are other examples of potential shared decision-making tools. On the left is a labor and delivery planning board provided by Ariadne Labs, and on the right is one of the whiteboards that are found in all the labor rooms at Von Voigtlander. I wanted to show you these two boards to help you start thinking about how you can utilize something as simple as a dry erase board in your labor room to communicate your values and preference, whether they've already been spelled out in a partnership document or not. If you do have a partnership document, you can plan ahead on which parts of it you would like displayed for your care team. You'll notice at the bottom of the Von Voigtlander whiteboard, there is a focus of care section. Often when you get admitted, your nurse will be the one to fill in this portion of at the beginning of your stay, and it might get updated at the shift stage. But it can also be used in any way that meets your needs. During your admission assessment, your nurse might ask you something along the lines of, what are your goals? And sometimes people hear that and think like, well, I'm here to have a baby. But you can use the nurse's question along with the focus of care part of the whiteboard as an opportunity to break that down into what do you want to do over the next hour or 2 hours or whatever interval feels most manageable to you. It can be a good way to periodically take a step back and look at how far you've come along in your labor or what you have accomplished. Let's say that your cervix isn't dilating as quickly as you had hoped it would, and you are feeling exhausted. That can be okay. Maybe you need to shift your focus to, for the next 30 minutes, I'm going to work on resting between contractions. If you are able to rest for 30 minutes in labor, that really is an accomplishment, because usually it's more like 12 consecutive 2.5-minute naps. So write it on your whiteboard as a reminder of how strong you've been. Yes, you heard me correctly. I just gave you the green light to write taking a nap on your to-do list and to consider it as an accomplishment. If you haven't taken a nap in a while and you need some practice at it, then that can be your homework for this class. I'm going to pause for a few seconds to allow you to think of some things that you might write down on your whiteboard. If you are using a partnership document to guide what you put on this board, keep in mind too that just because your partnership document is written in ink, it doesn't mean that you can't change your mind. And you can change it often if you want, just as often as you can erase the whiteboard. You're not held to what is or is not in your partnership document. That is to say, you may want to try things that are not listed on a document presented to you by your provider. If you want to try other things, then I would encourage you to discuss those with your prenatal care team, just in case it's not something that is offered normally at the hospital, so you can bring any equipment or tools that you might need to have to make that happen for you. It also means that you are not bound to the decisions or preferences that you have listed. You have the right to change your mind multiple times. Let's say that you wrote in your birth partnership that you plan to use the tub, but when you get admitted to the hospital, that doesn't sound appealing. So you tell your team, I don't want to use the tub, and you try a birth ball instead. That works very well for you. And a few hours go by, your contractions get stronger, and you're not comfortable on the ball anymore. Depending on how that initial conversation went about the tub, your provider, your nurse, or your support team might be assuming that you don't want to use it at all, and they might be hesitant to recommend that. You yourself may not mentally be in a place where it would naturally occur to you to get in the tub. That's why it's a good idea to review and reevaluate your preferences and options multiple times during your labor and birth experience. If you and your team refer back to that document, someone may be more likely to say, hey, is this a good time to try the tub now? At the top of the slide is another portion of the birth partnership document that discusses monitoring in labor. Earlier, I talked a little bit about the first part of this, which is the fetal monitoring being intermittent or continuous. But another consideration is the cervical exams that are often used to evaluate your progress. The options that you see here are intended to get some baseline knowledge about your preferences for cervical exams. However, there can be more to add in this section. Going back to the steps that we talked about with the admission decision process, how would this decision look for you? What do you think you know about cervical exams? What are some more options about how they can be done? If you've had a history of sexual abuse or assault, what options or steps can be taken to help you feel more in control during the exam? What are your preferences? Do you prefer to have as few people as possible in the room during an exam? What are the risks of having frequent cervical exams? And what can you benefit from having an exam? All of those might be questions that can be more thoroughly explored when you are developing a partnership document. You will be in a more informed position and have confidence that the decision support from your healthcare team and the summary information that you have is based on your values, preferences, and what is healthiest for you and your baby. One of the most difficult parts of transitioning into this role for Jill and I has been not having the opportunity to interact with moms and babies in the ways that we did before. So as Jill said, being able to speak with you all has been our pleasure, and we would like to sincerely thank all of you for allowing us to be a part of your journey. We truly hope that the information we have discussed today has been valuable to you and that it will be useful to you in your labor and birth experiences.
Thank you to Jill and Jessica and the Obstetrics Initiative. Please feel free to return to this recording at any time for your reference, and thank you for your participation.